how they take care of their eyesight, right?
Exactly. I mean, as any parent out there would want their kids to have the best vision that they possibly can 2020, and how, I mean, first of all, hence why we want to talk about today about what is it that we're going to be talking about in regards to myopia control in children and how can we prevent it, or what are the things that we need to be aware of. Hence why the topic for today, we have two very, very special guests here together with us here. We have Dr. SUNDERRAMASAMY, consultant ophthalmologist and a pediatrics ophthalmologist, together with Ms. LIEW Mei-Lin, who is the optometrist and a managing director of Home and Work Optometry Care. Thank you so much, Doctor, Ms. LIEW, for coming down here.
Thank you very much.
As I can see here, both of you are wearing glasses.
So you didn't need your glasses.
Yeah, I was reading in the dark, I think.
You were reading in the dark. Okay. And Ms. LIEW, your reason? No.
Yeah, we're studying too hard.
Studying too hard, right? Maybe I should have also worn my glasses. Now it feels very left out.
Okay, yeah. They can't see that we're wearing contacts over here. But okay, thank you so much to our fellow guests who are here talking about myopia control in children. But before we move on, we've had this chat earlier before we started. Again, there was a bit of a confusion, really understanding being an ophthalmologist and being an optometrist. Now, directly to Ms. LIEW, what are actually the difference here when we talk about ophthalmologists and optometrists? Please.
I would actually talk more about optometrists, all right, from a perspective as an optometrist. Optometrists are vision specialists, all right. We check the vision of individuals to identify whether they can see well or not. All right, and then from there onwards, we can prescribe glasses, contact lenses to correct their vision. And apart from that, we also help as frontliners in as a primary eye care to help detect eye diseases. And from there, if let's say a person is confirmed to have eye disease, then we'll refer to ophthalmologists for further treatment and medication. And besides that, apart from prescription of glasses, all right, we also prescribe vision therapy like exercises to train up children with lazy eye or squint eye problem.
So when the optometrist sends any kids or even adults, young adults, to an ophthalmologist, what do you then do? How do you then help eyesight?
So you don't just cut people's eyes out?
No, not really. So ophthalmologists, we are doctors. Trained further. And our job is to treat diseases. It can be through medication, and of course, if necessary, surgeries needed, then we go ahead with surgery. So we are the people who treat the diseases.
All right. Great.
Okay, so let's get back into our topic. Again, we're talking about myopia, right? To our audiences who are at home, who are a little unsure on what does myopia mean and what does it entail, can you please explain to our audience who are watching right now?
So what myopia means is short-sightedness. So the myopia we always talk about is axial myopia, which means your eyes become longer and longer. So your focus falls short, and that will give you a visual blur. So that's called myopia. The more common term is short-sightedness, or in Malay we call it rabun jauh. Yeah, so that's myopia.
No, I always get that mixed up because when you say like short-sightedness, does it mean that you can't see far? I mean, it's the opposite, right? If you're long-sighted, that means you can't see anything that's close.
That's what it means, but in Malay and English, it's just the opposite. So you can get confused.
So in Malay, when you say rabun jauh, it actually means you can't see far. And when you say rabun dekat, it means you can't see anything that's short, near, right? But in English, it's always the opposite. That's the best way to remember it.
Correct. Exactly.
Right. So because we're talking about myopia control in children, so let's dive into that a bit. To you, Doc, first. What is the common age actually when it comes to average child develop? When do they actually, when do you encounter the first cases of myopia in children, first of all? And is it something common for Malaysian children specifically to actually, get myopia at an earlier age?
A very good question. Actually, the average age we start seeing myopia, this is how it's been between around 6 years to 12 years. That means the primary school going years in Malaysia. But interestingly, I started noticing more and more children coming in earlier. And this is very true after this COVID pandemic. This last 2 to 3 years, 2020, 21, 22. A lot of children had to do online classes at home.
More screen time.
Lots of screen time. That kept them entertained. Anyway, you can't help it. So we are getting actually kids as young as 4 and 5 coming in with myopia. So it's a bit scary now. Earlier Much earlier than before.
Oh, that's actually, I've seen kids nowadays and they wear quite thick glasses because you can always tell how bad their eyesight is just based on the thickness of the glasses. You can tell like when their eyes suddenly are bigger and then they take off, it's actually smaller. But for you, you see a lot of, I'm sure you see a lot of kids as well as Miss Liu. Do you have a rough figure on how many kids need glasses nowadays or is affected by myopia?
Yeah, okay, thank you for having me today. All right, this topic is very true to my heart because I specialize in myopia care.
Okay.
Right, and it has become a very important topic, especially after the COVID pandemic. It is projected that in 2050, 50% of the world population will become myopic. All right, that is
50%.
Yes, 50% of the world population. And that is close to 5 billion of the world population. And from there, 10% is having high myopia of -5 diopter, which is in layman 500 degree or worse. 10% of population will be having high myopia. All right, try to imagine that. All right,
that's insane. My degree is like about like 150, slightly below 200, but I think that's like too much.
I'm guilty of that. Again, I mean, being an adult, I mean, the layman terms, my power.
Your power is
my power is 500. So yeah, without contact lenses, I'm practically blind. But again, those are staggering numbers. Those are actually worrying numbers looking at that because again, like I said, like what you said, actually, Doctor, as well. The world right now is very much digital. Everything is all on screen. Even in schools, we're introducing, the usage of tablets, computers, and whatnot. So it is a bit of a scary thought when it comes to children who has myopia and year in and year out, their, again, layman's term, power keeps on increasing on a yearly basis. And that's a scary thought, isn't it, looking at it?
Yeah, it's true, because now if you, like you said, throw back, you go back years, you're in your class, your classmates, 2 or 3 guys will be on glasses. And very often that used to be due to genetics. And genetics, can drive myopia. It can progress myopia. But now if you look at the same cluster of kids in a class, there are a lot more children wearing glasses. If you go to a primary school class in standard 5, maybe a third of the class will be wearing glasses already. And that means there's other interplay, other factors that come in to cause this progression, environmental factors. So you see children now don't go outdoors so much. Weather, safety, mosquitoes, many reasons. More attraction indoors. I've got a tab, I can play with it. I've got my father's phone, I can play with it. I'll learn the passcode and I'll play with it. And I like to read. Children, there are some children are voracious readers. I have kids who come in, finish one Harry Potter in 1 to 2 days. I take 1 month, they take 1 to 2 days. So these are the children who end up doing lots of near work and indoors, poor lighting most of the time, and that causes the eye to strain. And when the eye strains, the eyeball grows longer. There's a chemical in the eye, it's called retinal dopamine. It gets suppressed when you strain the eye. And because of that, the eye gets longer. And you have to realize when the eye increases by just 1 millimeter, your power increases by 300.
1 millimeter?
Say
1 millimeter.
Your power,
1 mm?
1 mm.
It's 300.
Yes.
300?
Yes.
Wow.
So we do get surprises. Sometimes children coming today, power is 150, 6 months down the line is 200, 250. So we get this marching power. So it's very scary, actually, to see this.
Because I mean, my parents, I love wearing glasses. It's not something people would, I don't encourage people to wear glasses, but I always thought like, wow, it's so cool to wear glasces. Until I actually started wearing glasses and I realized, it's so
No, I don't want to wear glasses anymore.
Because your eyes get tired, having to remember to clean your glasses as well. But so other than the fact that kids nowadays have more screen time, what are some of the factors, Ms. Liu, that you think also attributes to myopia in kids?
Yeah, actually, myopia is multifactorial. It's not just one cause. All right. So basically today, allow me to share, there are 5 main prominent causes to myopia. Number 1 is heredity. So if you have one parent being myopic, the offsprings, it will increase the risk of the offspring having myopia to be 3-folds. And if both parents are myopic, it will increase it to 3 to 8-folds.
3 to 8-fold.
3 to 8
The
folds.
probability.
Correct. Right. That's number one. And number two is ethnicity. So East Asian, being East Asian is not too good, right? As being myopia, all right? Yeah.
What about East Malaysian?
East Asian, for example, like Chinese, Japanese, Koreans are found to have a higher risk of having myopia.
Yeah.
Okay.
Right. And number three is lack of sunlight, healthy sunlight, or outdoor activities. Like what Dr. Sundar has mentioned, in an animal study, it has found that the retinal dopamine the retinal dopamine is actually being released when it's exposed to bright light. Okay, so if let's say children are mostly indoors, all right, a lot of near work, kept themselves at home most of the time, then it doesn't release or stimulate the release of retinal dopamine.
Right.
So as we know, the eyeball, when it elongates, right, it causes myopia to progress. So with less retinal dopamine, it doesn't serve as a protective factor in controlling the eyeball from elongation. Therefore, it leads to power to increase.
All right. I mean, it's again, we may take these things a bit for granted because again, you're wearing glasses, it's fine, it's okay. But again, until when? Because once the degree increases and increases and increases, again, there's nothing good that can actually come with it. My question to you, doctor, is that any parent out there, so I mean, like, is this reversible? Is it something that we can actually prevent, or should I say, like, heal? Or is it something like okay, we can't do anymore, so now it's just about managing?
So this is something I need to tell. Once you start getting myopia, you can't reverse it naturally.
It's irreversible.
Irreversible. So if you're 200, you're going to be 200. You can't bring it back to 100.
Or unfortunately.
Unfortunately.
Okay.
And we can suppress it now. In the old days, your power goes up, we just keep changing your glasses, and it just is that. But nowadays, we have treatment modalities. But before I go to that, I think what parents have to do now is get your kids outdoors more whenever you have a chance. Even if it's, they say 2 hours a day, but it's not possible in our environment, at least half an hour a day, in the evenings, whenever you can, or in the mornings, whenever you can, and that's one. Two, get them off the devices. Actually, there is a recommendation by the American Paediatric Association. See, below 2 years, no screen time. 2 to 5, 1 hour, but you hold the screen. You don't give it to the child. You want to teach ABC, you want to teach nursery rhymes, you hold it, because they take it from you, they're not going to give it back. Especially grandparents give, that's it, huh?
My younger sister, oh my goodness, she's an iPad kid, she's a tablet kid.
Very often the culprits. So when you go from 6 to 9, you can give them an hour and a half, maybe. 9 to 12, 2 hours, and beyond that, you know, they got schoolwork, they got projects and things, that's fine. So you control them as much as possible, especially weekdays, weekends, you can give them a bit more. So that's important.
Okay.
But we do have specific treatment now. We have actually what we call myopia control lenses in glasses.
Okay.
Myopia control contact lenses. The glasses works quite well. It suppresses the progression. There's one actually by Hoya. It's called MyoSmart DIMS. It works very well. I use it for quite a number of years, so that helps. We have eye drops, specific to control the strain in the muscles. So you put it every day in the night. You can put it for years and until you're about 12. We start around 6 years of age. So that's called atropine 0.01% eye drops. They're diluted atropine. It's very safe for children, and it's been used for many years now. So these help to suppress. So we can use it together, and it works very well. So we have treatment modalities that can actually help, which was not available before. And I think this is important because a lot of parents are not aware of this.
Even I wasn't aware that you have all these treatments. So for you, Dr. Liew, Ms. Liew, you mentioned earlier that you also do eye care, right? And whenever I go to the optometrist, the first thing I would do is that I would do the eye scan thing, even though I always want to just check if my power has increased. I have really bad astig, so that's my always constant worry. And then they always recommend, or they always teach me some form of eye exercise. Because again, I think to our audiences, we don't realize our eye is also a type of muscle, right? That we need to actually exercise. It's not just you look at something green. It's not just you look up and down. No, you have to exercise it to strengthen it. So what are some of the eye care exercises that our audiences could do at home, and could you possibly quickly teach us?
Yeah. Most likely, I'll share the 5 tips in eye care. All right. Number 1 is visual hygiene rule.
All right.
Do practice that. So what does it mean? Visual hygiene rule 20-20-20 means every 20 minutes of near work, rest your eyes by looking at something at least 20 feet away, which is equivalent to 6 meters away,
6 meters, yep.
for roughly about 20 seconds. All right, that's visual hygiene rule, number 1.
Okay.
All right, so that means don't continuously read non-stop for more than 1 or 2 hours. All right.
Don't need to be competitive. The book won't go anywhere.
Correct. All right. And number 2, outdoor activities, healthy sunshine. All right. And number 3, hold the reading material at the comfortable distance, which we call it Harman distance.
Okay.
Or elbow distance.
Okay.
You could actually teach your child by holding up a fist like this and place it underneath your chin. Where the elbow is the position where you should be holding your reading material.
Okay.
Not closer than that.
So,
all right?
so it should be
Okay.
in a rough estimate.
Yeah, we're
like
trying
this,
to do
right?
okay?
Yeah,
like this.
So it's more or less like an arm's length.
Okay.
So it depends on the person's stature.
All right,
A small person or a taller person, it can be different.
Yeah.
All right.
Okay.
And number 3, very important, is eye check.
Eye check. Yeah.
Yeah, eye check. All right. So children should get their first eye check by the age of 4 to 6 years old, where they start to learn, or where they start, or before they even start preschool. That's very important. So we should take eye check, like dental check, like part of the standard healthcare for the child. All right, because a lot of children, they can't tell and they do not know what is blurry vision, unfortunately. All right, they can't tell, because recently there's a launch of 1 Million Vision by Hoya. So there was a 11-year-old child, a girl, who came to share about her experience. She got her first pair of glasses at the age of 10.
Okay.
And her power was already -7 diopter, 700. Because she didn't know that she has been seeing or having blurry vision. She thought that everybody is seeing like what she's seeing. It's normal.
All right.
So
Because
therefore, it's very important.
It was normal for her, unfortunately.
Correct. She thought it's normal.
Okay.
So it's very important that parents bring their children for the first eye test before they start school.
Just to get it checked.
Yeah,
Wow.
that's
okay.
right.
So unfortunately, we have run out of time. We'll actually continue on our topic. I actually want to get on the nutrition aspect of taking care of your eyes. You can actually check out all of the tips on our social media. It's going to be freshbrew_RTM.
Exactly.
But for now, thank you so much for coming on our show. I'm immediately like trying to exercise